Budesonide is a corticosteroid used to treat Crohn's disease, asthma, COPD, hay fever and allergies, and ulcerative colitis. In this video, let's found. What is budesonide? What class of drug is budesonide? What is budesonide used to treat? Who cannot use budesonide? What are the side effects of taking budesonide? How does budesonide make you feel? How to use budesonide? What is budesonide? What class of drug is budesonide? Budesonide, sold under the brand name Pulmicort among others, is a medication of the corticosteroid type. It is available as an inhaler, nebulization solution, pill, nasal spray, and rectal forms. The inhaled form is used in the long-term management of asthma and chronic obstructive pulmonary disease. Budesonide was initially patented in 1973. Commercial use as an asthma medication began in 1981. It is on the World Health Organization's list of essential medicines. Some forms are available as a generic medication. In 2020, it was the 207th most commonly prescribed medication in the United States, with more than 2 million prescriptions. What is budesonide used to treat? Budesonide extended-release capsules are indicated for the treatment and maintenance of mild to moderate Crohn's disease. Various inhaled budesonide products are indicated for prophylactic therapy in asthma and to reduce exacerbations of COPD. A budesonide nasal spray is available over the counter for symptoms of hay fever and upper respiratory allergies. Extended-release capsules are indicated to induce remission of mild to moderate ulcerative colitis, and a rectal foam is used for mild to moderate distal ulcerative colitis. In addition, a delayed-release capsule formulation of budesonide is indicated to reduce proteinuria in adults with IgA nephropathy at risk of rapid disease progression. In Europe, budesonide is indicated to treat eosinophilic esophagitis (EOE) in adults. Who cannot use budesonide? Budesonide is contraindicated as a primary treatment of status asthmaticus or other acute episode of asthma where intensive measures are required. It is also contraindicated for patients who have hypersensitivity to budesonide. What are the side effects of taking budesonide? Nasal budesonide inhalers have been associated with a number of side effects. These include nose irritation or burning, bleeding or sores in the nose, lightheadedness, upset stomach, cough, hoarseness, dry mouth, rash, sore throat, bad taste in mouth, mucus, and blurred vision. Other symptoms which should be reported immediately include difficulty in breathing, swelling of the face, white patches in the throat, mouth, or nose, irregular menstrual periods, severe acne, and on rare occasions, behavioral changes, mostly affecting children. Pharmacodynamics. Budesonide is a glucocorticoid used to treat respiratory and digestive conditions by reducing inflammation. It has a wide therapeutic index, as dosing varies highly from patient to patient. Patients should be counseled regarding the risk of hypercorticism and adrenal axis suppression. How does budesonide work? The short-term effects of corticosteroids are decreased vasodilation and permeability of capillaries, as well as decreased leukocyte migration to sites of inflammation. Corticosteroids, binding to the glucocorticoid receptor, mediates changes in gene expression that lead to multiple downstream effects for hours to days. Glucocorticoids inhibit neutrophil apoptosis and demargination. They inhibit phospholipase A2, which decreases the formation of arachidonic acid derivatives. They inhibit NF-kappa B and other inflammatory transcription factors. They promote anti-inflammatory genes like interleukin-10. Lower doses of corticosteroids provide an anti-inflammatory effect, while higher doses are immunosuppressive. High doses of glucocorticoids for an extended period bind to the mineralocorticoid receptor, raising sodium levels and decreasing potassium levels. Half-life. Budesonide has a plasma elimination half-life of 2-3.6 h. The terminal elimination half-life in asthmatic children 4 to 6 years old is 2.3 h. How to use budesonide? Asthma. Maintenance treatment. Inhaled powder, 360 micrograms PO-Q12HR, in some patients, may be initiated at 180 micrograms Q12HR, not to exceed 720 micrograms Q12HR. Are there specific concerns about budesonide and pregnancy? US FDA Pregnancy Category B. Animal reproduction studies have failed to demonstrate a risk to the fetus, and there are no adequate and well-controlled studies in pregnant women. This drug should be used in pregnancy only if the benefit outweighs the risk to the fetus. That's all the information about budesonide we collected. Thanks for listening. Do not forget to like, share, and subscribe for the HeInfo channel if you like this video to update more health information.